Welcome everybody. Thank you for attending Healthcare Australia's Q&A nursing webinar. The idea of this is basically to run you through the whole process and answer as many questions as we can.
So, as Sarah has said, we're from Healthcare Australia. We're Australia's leading healthcare recruitment solution provider of nurses, midwives, aged care workers, doctors, allied health professionals and medical specialists in Australia. We do have work opportunities across Australia in every state and territory, and we're actually the leading international recruitment for UK and Irish healthcare professionals looking to move and relocate to Australia. Both Sarah and I are located in the London office. The idea of this is to guide you through the recruitment process before you arrive in Oz and to make your transition as easy as possible. Through this presentation, we're hoping to provide you with the information that you need to know. We're going to be covering topics such as APRA registration, visas, agency work in Australia, permanent nursing opportunities, rural and remote, and the different state requirements, which we will be covering throughout.
Okay, so Healthcare Australia is the largest nursing agency in Oz, with offices in each state. The beauty of this is you have flexibility to move around and explore Australia, and we'll be able to offer you shifts wherever you'd like to go. Or alternatively, if you wanted to base yourself in one location, that's fine as well. It's also good to know that you're not restricted to working in the cities. We also have work available in country and coastal towns, and even outback areas depending on your experience. As you're probably all aware, Australia is a massive country, so when working out your plans, take into account the fact that when it's raining and 10 degrees in Melbourne, it's most likely 35 degrees and blue skies in Darwin. If you're at all worried about travel plans and wondering where to go, these are things that we can discuss with you when planning your trip.
All right, so where to start? It is really hard to find the appropriate information and what you need to know to head to Australia. Key topics that you need to know is that you have to have your APRA registration to be able to work as a nurse in Australia, as well as have valid working rights. It's also important to know that you should have, to work for Healthcare Australia, we do need you to have a minimum of 12 months post-registration experience. We do suggest that you send us your CV so we can have a chat with you. We also want to hear about your circumstances when you're planning on heading to Australia, so we can provide you with the relevant information that's personal to you. One of the biggest topics here, which we will talk to about, is APRA registration. So APRA registration stands for the Australian Health Practitioners Regulation Agency. It is basically equivalent to the NMC. To work as a registered nurse in Australia, you are required to have your APRA registration. This is a national registration, so it does allow you to work across the different states without getting a registration for each individual state. So for example, if you no longer need to go get a nursing registration in Victoria or New South Wales, you're able to use your one APRA registration to travel throughout Australia. It is also your responsibility to obtain your registration. Healthcare Australia, we're unable to take you or help you with that APRA process. It is your responsibility, but of course we're happy to give you as many tips and answer as many questions as we can. APRA standards and requirements can change. That's why I can't stress enough, it is important that you check the APRA website and that you're reading all the relevant APRA documentation carefully. The APRA website is the www.ahpra.gov.au. As I'm sure many of you are aware, the APRA process does take some time. We recommend that you take this into consideration when arranging travel plans. On average, we find it takes 3 to 6 months to be processed. Your APRA application is assessed against the criteria for internationally qualified registered nurses. There are 8 different criteria that you need to meet. APRA requires that your overseas qualification is equivalent to the Australian bachelor's degree. APRA has recently changed this in February this year. These changes are specific to the diploma qualified nurses. You may find that because of these changes, APRA will request for additional information from your university, or they could suggest that you complete a board-approved bridging program. From my understanding, this is determined from a case-to-case situation. Really with this, I can only emphasise that you read the 8 different criteria carefully, as it does outline the standards that you need to meet. Once your application is processed, you will receive a letter of eligibility as well as an in-principle letter of approval. So that's basically advising that you need to attend one of the offices in Australia to finalise that registration. You will have 12 months to collect that registration from once you receive this letter. However, it does state on it that if you are unable to attend within 6 months, you will be required to provide updated certificates of registration status or certificates of good standing. This is once again outlined on the letter. What's also important to know and quite helpful to know is you don't actually need to go to the office that you applied for. For example, you can send your APRA application to the Adelaide office and then attend the Sydney office for that to pick up that registration number. It is important that before you do start looking for any permanent positions that you have your APRA registration. We cannot put you forward to a facility or a hospital as they will not consider any applications without having that APRA, either your registration number or that letter in principle. While you're waiting, however, we can provide you with opportunities to work as a personal care assistant, which is the same as like a healthcare assistant in Australia through Healthcare Australia, through the agency section. What Sarah and I were just going to go over are some commonly asked questions. These should be quite useful. A lot of people do struggle with the same things with the questions, I guess, on the form. So Sarah, if you would like to go over that, we'll go over the frequently asked questions now.
Yeah, okay. So first and foremost, how much does the APRA registration cost?
The APRA registration is a total cost of $540, so it's about £270.
And how can you pay for it?
You can pay for your registration using your Visa or MasterCard.
Cool. And can I just send my degree certificate, or do they need my university transcripts?
No, you do actually need to submit all your transcripts. They're quite specific of what they want to know. APRA requires your course transcripts to clearly outline the clinical hours of practice as well as your training, your theoretical hours of training. It is important to read that what's outlined in that framework.
Great. And who can certify my documents for me?
So APRA will not return any of your original documents so that you post with your application. So we advise that you do only send certified copies. They're very clear about who is eligible to certify copies. Instructions are on their website. We would suggest either Justice of Peace or Notary Public.
Great. And what about an IELTS test? Do I need to sit one of those to do my APRA registration?
Yeah, this is a common question that we get asked. This does depend on your education. It does state that it's not necessary to sit the IELTS test if you can demonstrate you've completed 5 years full-time of education taught and assessed in English. What we would suggest is, or most applicants get a letter from their secondary school outlining this.
Great. And also I wanted to know, what do I put down as my residential address?
You just put down your residential address in the UK. What a lot of people get confused is in section D, question 7, is the address your principal place of practice the same as your residential address? It's fine to answer yes for this question, as you will not have an Australian principal place of practice at the time of your APRA application.
Fantastic. And what about a visa? Do I need my visa to be granted before I apply for APRA?
No, you do not need a visa to apply for your APRA. What APRA will say that you do need a visa when you collect your registration number. So once you've got that letter and you go into the APRA office in Australia, you will need to have a visa then. However, it does not have to have working rights. So you can actually pick up your APRA registration on a holiday visa. So a lot of people do just travel to Australia to pick up that number on the holiday visa.
Fantastic. And when I get over there, would you recommend getting insurance? How should I go about that?
We definitely recommend everyone travels with travel insurance. Our partners are here in the room. They can provide you information on travel insurance. However, with workplace or professional indemnity insurance, we at Healthcare Australia, you will be covered for insurance when you work through agency through us. So you do not need to obtain your own insurance there.
Fantastic. Do I need a reference from my employer to apply, or a certificate of service?
No, you don't. APRA actually doesn't request for a professional reference in the application form. We have from time to time received feedback from candidates that on the odd occasion APRA has requested for an additional written reference. So, it doesn't hurt to send one with your application. However, if you are going to do it, we do recommend you look at what needs to be specifically outlined in a written reference. With a certificate of service, you are requested to outline or seek a statement of service from all your employers in the past 5 years. So make sure you do look up what exactly needs to be included on that statement of service as well.
Great. Okay, as Ruby has already mentioned, there are two basic things you need to get nursing in Australia. One being your APRA registration, which we've discussed, and the other being valid work rights. If you are eligible, a working holiday visa is by far the best way to get you nursing in Oz. It can be granted in a matter of days and only costs a few £100s to get. Bear in mind though that you will need to get a medical too, which is an extra cost, and this is basically because you'll be working in a hospital in Oz. As it says here, you'll need to be at least 18, but not yet 31 years of age. You also need to be from an eligible country. If you're not sure about this, I recommend logging on to the Australian Immigration website to find out more. The address is just at the bottom of the screen there. Okay, I also want to run through the 457 sponsorship visa and what it means for nursing jobs in Australia. We have so many inquiries regarding this visa, so it's important to understand how the process works when determining whether you are likely to get a sponsored position. Basically, as I'm sure you can appreciate, every Australian business is obligated to demonstrate a strong commitment to employing local labour. So to put this in nursing terms, it's unlikely that an Australian hospital will spend the associated time and costs in employing, say, a general medical surgical nurse, when at present they can easily source a local nurse in Oz. On the flip side, if you're a nurse with a specialty in short supply in Australia, a hospital will be much more likely to use the 457 sponsorship route in order to fill that position. So to give you an example, there is currently a huge demand for theatre scrub scout nurses in Oz. So at the moment, a scrub scout nurse would probably have much more luck in getting a sponsored position. In saying this though, keep in mind that supply and demand is always changing, so if in doubt, give us a call and we can let you know. Last but not least is the skilled migration visas. So these allow you to work in Australia as a permanent resident. It is absolutely fantastic that nursing is an occupation on the skilled workers list. So in short, if you're thinking of permanently migrating or even staying a bit longer than your working holiday visa allows, then this is most likely your best bet. It's done on a points-based system, so there are other factors to take into account. I suggest you go onto the Australian Immigration website to accurately assess whether you're eligible. Healthcare Australia offers agency work in every state and territory. Agency work is fully flexible, so you can work as much or as little as you want, and all you need to do is let us know your availability. This means working as an agency nurse is a great solution if you're wanting to work your way around Oz, or even if you're simply wanting to pick up a few extra shifts every now and again for some extra spending money. If the idea is to seek permanent employment, agency also allows you to keep working whilst you're finding your feet in Oz. It also gives you an insight into different hospitals and locations to gain an idea of where you might like to end up. Getting you signed up for agency is a relatively fast and streamlined process. The first step is you sending us your CV, and we'll talk you through the rest.
So Healthcare Australia has a national permanent recruitment division. We're in a unique position to offer permanent roles with many of Australia's most well-known healthcare providers. We have specialist recruitment consultants in each state to find you work. The process does depend on what visa you are looking for. As Sarah has explained, sponsorship opportunities are limited. The process is to send us your CV. We review and have a chat about where you'd like to go, when you'd like to head to Australia to find out the best opportunities for you. We then explain the APRA process to you and make sure that you do have what's required to look for a permanent job. If you do need to understand when looking for a permanent job, that it is recommended that you're happy to relocate within 3 to 4 months. What we do is we help you format your CV to highlight the skills and experience and education that you have. We would hand you over to the recruitment consultant in Australia that would then put your CV forward to relevant positions. We'd then organise interview and reference checks, making sure everything's organised before you arrive in Australia. We also have rural and remote and regional opportunities in Australia. With rural, remote and regional opportunities, these are placements that can range from anywhere from 6 weeks to 6 months. We cover coastal areas, country towns, as well as outback Australia. Obviously, these placements differ quite a lot, as Australia is a big country. With placements, you can get travel incentives as well as allowances. You may even get your accommodation provided for. Obviously, with this as well, there are different ranges of skills and experience that's required for a placement.
Okay, so as I'm sure you're all aware, your APRA registration allows you to nurse across Australia. However, on top of that, depending on which state you are planning on nursing, there are a few other bits and pieces in which you'll need to do in order to be able to nurse in that particular state. It's nothing too much to stress about. We can send you a comprehensive list of the state-specific criteria. But to give you an example, in order to nurse in New South Wales, say, there are certain vaccination requirements which you need to adhere to. We will be more than happy to talk you through what's required, most of which can be sorted out before you leave. One thing which is required in all states, however, is for you to complete a handful of competencies. These are things which I'm sure you will have done before, competencies like fire safety, drug calculation, and we do ask you to complete them through us, as that will ensure you are fully compliant and ready to nurse in Oz. We're happy to provide you with all these modules through our online e-learning, which means you can get this all sorted before you leave. Then the only thing left to do is the practical elements of your basic life support and manual handling, which we also offer free when you come in for your orientation in Oz.